A stroke occurs when blood flow to the brain is interrupted, causing brain cells to die from lack of oxygen. Strokes are a leading cause of disability and death worldwide. However, up to 80% of strokes are preventable through lifestyle changes and proper management of risk factors. Here are effective ways to help avoid stroke. Control blood pressure. High blood pressure damages blood vessels, allowing fatty deposits to build up and block arteries that supply the brain. Keep blood pressure below 120/80 mmHg through diet, exercise, and medication if prescribed. Lose extra weight. Reduce sodium, manage stress, and take blood pressure medicine as directed. Lower high cholesterol. High cholesterol levels in the blood can lead to clogged arteries and limited oxygen to the brain. Keep total cholesterol under 200 mg per deciliter. Cut down on saturated fats, trans fats, and foods with high dietary cholesterol. Increase fiber with whole grains, fruits, and vegetables. Your doctor may prescribe cholesterol-lowering statin medication. Prevent and manage diabetes. Diabetes makes you up to 4 times more likely to have a stroke since it damages blood vessels and causes plaque buildup. If diabetic, maintain an optimal HbA1c level through diet, exercise, medication, and regular testing. Consult your doctor about medications to lower stroke risk if diabetic. Eat a healthy diet. Eat plenty of fruits, vegetables, whole grains, and lean proteins. Avoid excess sodium, saturated fats, trans fats, refined carbohydrates, and added sugars. Focus on nutrient-dense foods to nourish your body and brain. Stay hydrated by drinking water instead of sugary beverages. Exercise regularly. Physical activity, for at least 30 minutes per day on most days, controls weight, lowers blood pressure, and improves circulation. Brisk walking, swimming, cycling, and strength training are excellent options. Always check with your doctor prior to starting a new exercise program. Maintain healthy weight. Excess body fat strains the cardiovascular system, especially if carried around the midsection. Losing just 10 pounds can dramatically lower your blood pressure and stroke risk. Work toward a body mass index, BMI, between 18.5 and 24.9 through diet and regular exercise. Limit alcohol intake. Drinking too much alcohol raises blood pressure and triglycerides, damage directly related to stroke risk. Men should consume no more than 2 drinks per day, women 1 drink per day. It's healthiest to avoid alcohol completely. If you do drink, pace yourself. Quit smoking and vaping. Smoking damages arteries and thickens blood, impeding blood flow to the brain. The chemicals in vaping and e-cigarettes also raise stroke risk. Nicotine constricts blood vessels. Quitting improves circulation almost immediately. Ask your doctor for help kicking the habit. Reduce stress. Chronic stress releases hormones like cortisol into the bloodstream, inflaming blood vessels and raising blood pressure. Manage emotional stress through meditation, yoga, deep breathing, and talking with friends. Make time to unwind and do activities you enjoy. Get enough quality sleep. Not getting the recommended 7 to 9 hours of restful sleep each night raises your risk of stroke. Poor sleep is linked to high blood pressure, inflammation, and weight gain. Go to bed and wake at consistent times and avoid screen time before bed. Treat sleep apnea if present. Take a baby aspirin if advised. For some patients at increased risk of stroke, a daily low dose, 81 mg, aspirin may be recommended. Aspirin acts as a blood thinner to prevent clotting. Always consult your doctor before starting aspirin therapy as side effects are possible. Know the signs of stroke. Call 911 immediately if showing signs of stroke like sudden numbness of the face or limb, confusion, severe headache, blurred vision, dizziness, or trouble walking or speaking. Activating emergency response quickly improves outcomes. Schedule regular wellness exams. See your doctor at least once a year for blood pressure, cholesterol, and diabetes screening. Discuss your risk factors and ways to lower your chances of having a stroke. Develop an action plan together. Follow up promptly on testing or screenings. By adopting lifestyle measures focused on healthy diet, active living, maintaining ideal weight and controlling risk factors, you can significantly cut your chances of having a stroke. Work closely with your healthcare provider to reduce your personal risk. With diligence and proactive preventive care, a stroke can happen at any age and derail your life in an instant. While some risk factors are out of your control, like family history, there are many preventive steps you can take to reduce your risk. Avoiding stroke requires awareness and proactive changes. Continue reading for more in-depth ways to help prevent stroke. Stop smoking entirely. Smoking not only damages lung tissue, but also causes plaque buildup through the entire circulatory system. The chemicals in tobacco smoke harm blood vessels that feed the brain. Smoking cessation immediately starts to improve circulation. Ask your doctor about nicotine replacement therapy, prescription medications, and counseling to support quitting. Cut down on caffeine. Drinking more than 3 to 4 cups of coffee per day may increase stroke risk. Caffeine is a stimulant that can raise blood pressure acutely. Limit coffee, tea, soda, and energy drinks containing caffeine. Substitute with water, sparkling water, or herbal tea instead. Follow doctor's orders for atrial fibrillation. Irregular heartbeat, especially atrial fibrillation, raises the chance of blood clots forming that can travel to the brain. Taking blood thinners as prescribed prevents clot formation. Other treatments include electrical cardioversion, ablation procedures, or surgery. Treat sleep apnea. Interruptions in breathing during sleep decrease oxygen to the brain. See a doctor if you suspect sleep apnea based on symptoms like snoring, daytime drowsiness, and waking gasping for air. Treating sleep apnea with CPAP or oral devices is key. Keep blood sugar steady. In diabetics, fluctuating blood sugar levels strain blood vessels. Check glucose frequently, take medicines correctly, and follow the recommended diabetic diet. Work closely with your endocrinologist. Avoid skipping or delaying meals. Increase omega-3 fatty acids. Eating foods high in omega-3s like fish, walnuts, and flax seeds supports cardiovascular health. They make blood platelets less sticky and promote artery flexibility. Aim for at least 2 servings of fatty fish per week. Consider a supplement too. Take a CoQ10 supplement. CoQ10 is a naturally occurring nutrient vital for energy production in cells. It also acts as an antioxidant to protect blood vessels. Low levels may correlate with increased stroke risk. Daily CoQ10 supplements from 100 to 200 milligrams support cardiovascular health. Find healthy stress relief. Untreated chronic stress takes a toll on the body, negatively impacting blood pressure, inflammation, and circulation. Set aside time each day to decompress through yoga, meditation, massage, nature walks, or just relaxing with a good book. Keep work-life balanced. Stay mentally stimulated. Engaging in intellectually and socially stimulating activities seems to boost blood flow to the brain. Take a class, learn a language, challenge yourself with puzzles, or join a book club. Having a purpose and staying sharp may fend off strokes. Avoid hormone therapy. Postmenopausal hormone replacement therapy boosts stroke risk, especially with synthetic progesterone. Speak to your gynecologist about safer alternatives for treating menopausal symptoms like hot flashes. Lifestyle changes help too. Limit Tylenol. Frequently taking Tylenol/acetaminophen may alter blood thinner effects of some medications. Stick to the dosage on the label. Check with your pharmacist about medication interactions if you take blood thinners. Painkillers also raise blood pressure. Control atrial fibrillation risk factors. High blood pressure, sleep apnea, being overweight, and diabetes make atrial fibrillation more likely. Keeping these conditions well managed lowers your chance of developing arrhythmias that can cause stroke. Walk more daily. Aim for at least 30 minutes per day of moderate intensity walking to boost circulation, burn calories, and manage stress. If possible, take 3 10-minute walks versus 1 long session. Going for walks with friends adds socializing too. Consume tea or coffee daily. Having 1 cup of coffee or tea per day may lower stroke risk more than avoiding it altogether. The key is moderation. The antioxidants and anti-inflammatory compounds offer protection. Just avoid adding sugars and heavy creams. Protecting your brain and cardiovascular health involves both treating existing medical conditions as well as making preventive lifestyle changes. Work closely with your doctor to control individual risk factors. Maintain overall wellness through nutrition, activity, and stress management. From controlling high blood pressure to maintaining healthy cholesterol levels, many factors influence your stroke risk. While some risks cannot be changed, implementing preventive strategies can significantly reduce your chances of having a stroke. Read on for more ways to minimize your risk and keep your brain healthy. Increase potassium intake. Eating foods higher in potassium supports healthy blood pressure levels. Good sources include bananas, potatoes, tomatoes, kidney beans, spinach, and yogurt. Potassium lessens sodium's effects on blood pressure. Aim for 3,500 to 4,700 milligrams of potassium daily. Eat more fiber. Soluble fiber helps remove excess cholesterol from the body before it can stick to artery walls. Get more fiber from oats, beans, apples, Brussels sprouts, and flax seeds. Gradually increase fiber to avoid bloating and gas. Drink plenty of water too. Have 1 to 2 drinks max per day. If you do consume alcohol, keep it to a moderate amount defined as 1 drink or less per day for women and 1 to 2 for men. 1 drink equals 12-ounce beer, 5-ounce wine, or 1.5-ounce spirits. More than this raises blood pressure and stroke risk. Treat obstructive sleep apnea. When breathing stops periodically during sleep, less oxygen reaches the brain, increasing stroke risk. Seek evaluation for snoring, tiredness during the day, or gasping awake at night. Treating apnea with CPAP improves oxygen levels. Keep moving throughout the day. A sedentary lifestyle strains the heart and impacts circulation. In addition to regular workouts, avoid sitting for long periods. Take brief activity breaks every 30 minutes, walk, stretch, or take the stairs. Movement keeps blood flowing. Manage atrial fibrillation aggressively. Irregular heartbeat like atrial fibrillation allows blood clots to form that can travel to the brain. Medications can regulate rhythm. Ablation therapy destroys problem tissues. Consult your cardiologist about best treatment options. Treat depression. Research shows depression raises stroke risk, partly due to changes in brain blood flow. Seek therapy and treat depression with professional support, medications, or lifestyle changes like more exercise. Don't delay getting help. Have good oral health. Gum disease and tooth loss are linked with higher stroke risk, likely due to increased inflammation. Brush and floss thoroughly each day and see your dentist every 6 months. Treat any gum problems promptly before they worsen. Avoid hormone replacement therapy. The heightened stroke risk some women face from hormone replacement therapy likely outweighs benefits for most. Discuss alternatives like lifestyle changes, vaginal estrogens, and treating specific symptoms. Evaluate risks versus benefits. Prevent blood clots. Conditions like atrial fibrillation raise odds of blood clots that can move to the brain. Your doctor may prescribe blood-thinning medications to prevent clots from forming and lowering stroke risk. Take as directed. Listen to your body. Pay attention if you suddenly develop numbness, lose coordination, have vision changes, or get severe headaches. These may indicate mini strokes and warrant urgent medical care before a full stroke occurs. Call 911 or go to the ER. Reduce inflammation. Chronic inflammation damages blood vessels, increasing susceptibility to plaque buildup and clots. Combat inflammation through diet, exercise, stress relief, and limiting alcohol. Talk to your doctor about checking your CRP level. The more healthy habits you consistently practice, the lower your stroke risk. Work closely with your healthcare providers to manage individual risk factors. Make lifestyle changes to keep your blood vessels clear and brain functioning optimally. Although some risks are unavoidable, proactively minimizing as many as possible. From managing medical conditions to making smart lifestyle choices, many factors play a role in stroke prevention. While some risks cannot be changed, implementing preventive strategies can significantly reduce your chances of having a stroke. Read on for more ways to minimize your risk and keep your brain healthy. Keep triglycerides low. High triglyceride levels damage artery walls and impede blood flow. Have fasting triglycerides checked annually and aim to keep levels below 150 mg per deciliter. Losing weight, limiting alcohol, exercising, and avoiding refined carbs helps lower triglycerides. Increase good cholesterol. HDL cholesterol removes plaque buildup in arteries. Check your HDL levels annually and aim for higher than 40 mg per deciliter in men and 50 mg per deciliter in women. Quit smoking, exercise more, and lose weight to boost HDL. Some people may benefit from cholesterol medication. Find healthy stress relief. Untreated chronic stress takes a toll on the body, negatively impacting blood pressure, inflammation, and circulation. Set aside time each day to decompress through yoga, meditation, massage, nature walks, or just relaxing with a good book. Keep work-life balanced. Moderate caffeine intake. Drinking more than 3 to 4 cups of coffee per day may increase stroke risk. Caffeine is a stimulant that can raise blood pressure acutely. Limit coffee, tea, soda, and energy drinks containing caffeine. Substitute with water, sparkling water, or herbal tea instead. Eat more nitrate-rich foods. Nitrates help improve blood vessel elasticity and increase vasodilation to enhance blood flow. Add foods like beetroot, spinach, arugula, Swiss chard, radishes, celery, and collard greens to your diet. Try juicing veggies for an easy nitrate boost. Monitor blood pressure at home. Home monitoring reveals your normal BP range better than occasional office readings. Ask your doctor for a recommended arm cuff monitor. Record daily readings over several weeks and share data with your physician at appointments. Walk more daily. Aim for at least 30 minutes per day of moderate intensity walking to boost circulation, burn calories, and manage stress. If possible, take 3 10-minute walks versus one long session. Going for walks with friends adds socializing too. Take medications correctly. Prescribed medications only work properly when taken as directed. Use reminders to take pills on time and at indicated dosages. Never adjust or stop medication without your doctor's guidance. Report any side effects promptly. Learn to manage stress well. Adopt healthy stress management strategies like getting enough sleep, carving out me time, positive self-talk, deep breathing, and yoga. If overwhelmed by stress, speak to a therapist. Unmanaged stress takes a major toll on your health. Keep your mind active. Engaging in intellectually stimulating activities seems to boost blood flow to the brain. Take a class, travel, learn a language, play bridge, work puzzles, or pursue a new hobby. Staying sharp through activities you enjoy may fend off strokes. Stay socially engaged. Loneliness and isolation appear to impact cardiovascular health. Nurture meaningful relationships with family and friends. Join a club, volunteer in your community, or attend social events. Feeling connected benefits your health. Prioritize restful sleep. Aim for 7 to 9 hours of quality sleep per night to allow the brain and body to restore. Having a consistent bedtime and wake time helps regulate your circadian rhythm for better sleep. Limit electronics before bedtime. Drink coffee or tea. Having 1 to 2 cups of coffee or tea per day seems to lower stroke risk more than avoiding it altogether. The antioxidants and anti-inflammatory compounds offer some protection. Just avoid adding sugars and heavy creams. Your prevention strategy should target controllable factors with a physician's guidance while also focusing each day on healthy lifestyle habits, like staying active, eating right, maintaining healthy weight, avoiding smoking, and managing stress. Consistency with small daily improvements reduces risk. While some factors like age, gender, and genetics cannot be changed, focusing on modifiable risk factors can significantly lower your chances of having a stroke. High blood pressure. Hypertension strains blood vessels, allowing plaque buildup that can limit blood flow. Keep blood pressure below 120/80 mmHg through diet, exercise, medication, and home monitoring. Lose weight if needed and reduce sodium intake. Take medicines as prescribed. High cholesterol. Cholesterol plaque narrows arteries that supply the brain with oxygen. Keep total cholesterol under 200 mg per deciliter through diet and physical activity. If levels remain high, your doctor may prescribe a statin medication to lower cholesterol. Take as directed. Diabetes. Uncontrolled diabetes damages blood vessels, increasing plaque formation. Carefully manage diabetes through diet, exercise, oral medications, or insulin as needed. Monitor blood sugar levels daily and maintain an HbA1c under 7%. See your doctor regularly. Obesity. Excess body fat strains the circulatory system. Losing even 10 pounds can dramatically reduce blood pressure. Reach and maintain a healthy BMI through calorie reduction and 150 minutes per week of moderate exercise. Physical inactivity. Lack of exercise contributes to obesity, high blood pressure, and diabetes. Aim for 150 minutes per week of moderate intensity activity like brisk walking. Incorporate strength training too. Start slowly and check with your doctor. Smoking. Smoking damages blood vessel walls, leading to narrowing. The chemicals in tobacco smoke thicken blood and make clots more likely. Quitting smoking is critical. Speak to your doctor about cessation aids. Avoid secondhand smoke too. Heavy alcohol use. Drinking too much alcohol over time raises blood pressure. It also contributes to obesity, atrial fibrillation, and certain blood cancers that increase clot risk. Men should limit alcohol to 1 to 2 drinks per day, women just 1 drink daily. Sleep apnea. Interrupted breathing while sleeping reduces oxygen flow to the brain. Seek evaluation for symptoms like loud snoring, daytime drowsiness, and gasping awake. Treating sleep apnea improves nighttime oxygen saturation. Stress. Chronic stress releases hormones that inflame blood vessels and spike blood pressure. Make lifestyle changes to manage stress. Try yoga, meditation, deep breathing, soothing music, and laughter. Talk to a therapist if overwhelmed. Birth control pills. The estrogen in some birth control pills can slightly increase stroke risk. Speak with your gynecologist about progesterone-only alternatives or lower-dose estrogen options. Always weigh risks against benefits. Atrial fibrillation. AFib causes irregular heartbeat that allows blood clots to form that travel to the brain. Medications can help regulate heart rhythm. Procedures like ablation may correct arrhythmias. Discuss best treatment options with your cardiologist. Prior stroke. If you've had a previous stroke, you are at higher risk of having another one. Aggressively control risk factors with your doctor's help. Stay compliant with medications, diet, exercise, and close monitoring. You have the power to reduce your odds of having stroke through diligent lifestyle measures and properly managing existing medical conditions. Awareness and proactive prevention are key. Work closely with your healthcare providers to stay on top of your personal risk. While some stroke risk factors are out of your control, many can be positively influenced by daily habits and lifestyle choices. Making your health a priority through nutrition, activity, weight control, and proper medical care can dramatically reduce your chances of having a stroke. Follow a nutritious diet. Eat plenty of fresh fruits, vegetables, whole grains, lean proteins, and healthy fats like olive oil and avocados. Limit sugar, salt, saturated fat, processed foods, and refined grains. Stay hydrated with water and herbal tea. Take a multivitamin to fill any nutritional gaps. Exercise daily. Get at least 150 minutes per week of moderate exercise like brisk walking, swimming, or cycling. This strengthens the heart, burns calories, and lowers blood pressure. Incorporate resistance training too to build muscle. Even short 10-minute sessions make a difference. Maintain healthy weight. Being overweight strains the cardiovascular system. Losing even 5 to 10 pounds can significantly decrease your blood pressure. Reach and maintain a BMI between 18.5 to 24.9 through portion control, reduced calories, and regular exercise. Monitor blood pressure. Check your BP at least twice per month either with a home monitor or visits to the pharmacy. Keep levels consistently below 120/80 mmHg record readings to discuss with your doctor and make any needed medication adjustments. Don't smoke or vape. Cigarettes and vaping constrict blood vessels and make blood prone to clotting. The chemicals damage delicate artery linings. Avoid exposure to any type of smoke. Get help quitting if needed through counseling and nicotine replacement. Limit alcohol intake. Drinking more than 1 to 2 servings of alcohol per day raises blood pressure and stroke risk substantially. Limit intake to no more than 1 drink per day for women or 1 to 2 for men. 1 drink is 12-ounce beer, 5-ounce wine, or 1.5-ounce spirits. Reduce stress levels. Chronic stress releases inflammatory hormones that injure blood vessels. Set aside time each day for healthy stress relief like yoga, massage, meditation, walking outside, or listening to music. Maintain balance between work and leisure. Treat sleep apnea. Pauses in breathing during sleep reduce oxygen flow to the brain. Seek evaluation for symptoms like snoring, waking gasping for air, and daytime fatigue. Treating sleep apnea improves nighttime oxygenation. Stay socially active. Loneliness and isolation seem to negatively affect cardiovascular health. Surround yourself with positive social connections by volunteering, joining a club, or planning regular activities with friends and family. Get screened for diabetes. Diabetes damages delicate blood vessels, increasing stroke risk. See your doctor annually to have fasting blood glucose and HbA1c tested. If diabetic, keep blood sugar tightly controlled through medication, diet, and exercise. See your doctor regularly. Have an annual physical to review stroke risk factors. Discuss any necessary lifestyle changes or medications to control high blood pressure, cholesterol, and diabetes. Routine care allows early intervention. Living an overall heart-healthy lifestyle is key to stroke prevention. Focus each day on nutrition, exercise, stress management, and avoiding smoking. Work closely with your healthcare providers to manage any medical conditions. Healthy habits endure